So let's talk about infection and infertility. And
Definitely. Like Ken mentioned, we should always, if you're having concerns about exposure to an infection, or if you're having symptoms that you think is an infection, to be evaluated and treated appropriately. There are many women who have undiagnosed pelvic infections that either don't get treated or get treated later. And we know that pelvic infections in women, specifically with gonorrhea and chlamydia, can cause inflammation in the fallopian tubes, can cause infections within the pelvis, and that can lead to infertility, mainly by causing scarring in the fallopian tubes and eventual blockage of the tubes if the infection is severe enough. And if your tubes are blocked, then that's going to make it very hard for sperm and egg to meet in the tube to allow normal fertilization for pregnancy.
so one of the things that I think I'd like to have our people know is that I think we've jumped from trying to do zip and if and gif and so forth and so on, that we basically do not let the doctors decide they're going to do tubal reanastomoses and so forth. And I think the newest technology now is to just go straight to IVF. And if you have tubal disease, if your tubes are blocked, don't let somebody convince you that I can go in and we can open your tubes and so forth and so on. Or, so speak on that topic, and let's talk about ectopics that people have had and how they affect infertility and what they should think about.
Yes, well, definitely, tubal reversal is an old surgery where if the tubes were blocked, or if a woman had had a tubal ligation previously, that we can go in and remove that abnormal or scarred portion of the tube in the middle and reconnect the normal ends to allow the tubes to function normally. That still may be an option for some women, particularly if they're younger, if they want to have multiple children, if they've had certain types of tubal ligations that are easier to reverse. But the majority of women will have better success going directly to IVF, which basically bypasses the tubes, and we can take normal embryos and put them directly back in the uterus without having to do surgical correction of the tubes. One of the problems with doing the tubal reversal surgery is that even if tubes are normal at the time of surgery, there can be scarring of the tubes. That's part of the normal healing process after surgery, which can cause the tubes to close again. And if the tubes are open at the surgery and blocked later, then you're ultimately going to need to get to IVF anyway. So a lot of folks are going directly to IVF and bypassing the surgery altogether.
And I think that's a major issue. Later on, we're going to ask you, what is the process of IVF? What do they expect to have to do? And also, let's move on to lifestyle, getting pregnant and how we have a healthy baby and so forth.
We already talked about how important it is to have a healthy weight before you get pregnant, and also throughout a pregnancy to reduce some of those medical complications that we already mentioned. Also, it's important to reduce other exposures like excessive alcohol intake, tobacco exposure, either directly smoking or secondhand smoke, can affect the egg quality, the development of eggs in the ovaries, and it can actually accelerate the aging process in the ovaries. So we do recommend removing those exposures to improve your chances of getting pregnant.
And what about folic acid and biotin?
We definitely recommend starting the prenatal vitamins in the months prior to trying to get pregnant, and that's because they're very early structures that are developing in an early pregnancy between 4 to 8 weeks. And so if you wait until you have a pregnancy that's diagnosed, which is usually 4 or 5 weeks of that pregnancy, it's a little bit late to start taking the vitamins when some of those vital structures have already started to develop. So we do recommend starting the vitamins a few months before trying to get pregnant. And a good multivitamin or prenatal vitamin, which includes folic acid, is important for the neurological development and the nervous system and spine development.
And I think this is really important because basically, we do it in our office, and I know they probably do it in your office, that we need to sit down and give you an outline of what you need to do to get pregnant. So we evaluate your weight, we look at your eating habits, your lifestyle. You can't have that liquor on Saturday night anymore if you're trying to do this and take your folic acid. So talk to us a little bit about that and how it works in your office and so forth and so on.
We definitely do the same, just a general health assessment. We look at your GYN or your reproductive history to see if there are any factors that may affect your fertility, like if you've had pelvic infections before, STDs in the past, or sexually transmitted infections in the past, if you have uterine fibroids or things like that we may need to address early on. So it's important to have that visit, and that's also a good opportunity for us to talk about ovarian reserve.
And this is not expensive. It's very affordable.
It's a routine office visit. which is covered by most insurance plans. Most of them will cover, routine exam and diagnostic type of things. When you get into fertility treatments is when some insurance companies may not provide as much coverage for that.
And what if I don't have money? I mean, basically, what is an office visit, and what could you do for our listeners out here?
A standard office visit is going to be, a physician's visit is about $300 or so for the visit. There's additional testing. It depends on the testing, but we work with patients to, not just order everything under the spectrum, but to focus and get the be most efficient with our resources and just get the tests that we need to get that information in moving forward. And so we can definitely work with patients and scale back on what we need to do.
And you can